Today, we are going to talk about jaundice. Jaundice is a condition where the skin, eyes, or mucous membranes turn yellow because of an increased level of bilirubin in the blood. Bilirubin is a yellow pigment produced when red blood cells break down. When the body cannot clear it fast enough, the main sign of newborn jaundice is yellowing of the skin and whites of the eyes, which typically starts on the face and spreads to the chest, abdomen, and legs. Other symptoms can include unusual sleepiness, poor feeding, irritability, and a lack of wet or dirty diapers. It is important to seek medical attention if the yellowing worsens or spreads, or if the baby seems unusually ill. Visual signs: yellowish color of the skin and whites of the eyes. The yellow color typically appears on the face first and then moves down the body. For babies with darker skin, the yellowing may be more visible on the soles of the feet and palms of the hands. Behavioral signs: unusual drowsiness. The baby may be difficult to wake up for feeds. Poor feeding. The baby may not nurse or suck from a bottle well. Fussiness or irritability. The baby may be unusually fussy. High-pitched crying. This can be a sign of severe jaundice. Other signs: lack of wet or dirty diapers. The baby may not be producing enough wet diapers. Pale colored stools. The stool color may be pale or clay colored. Nurses' responsibilities toward a baby with jaundice. Caring for a jaundiced newborn requires early recognition, continuous monitoring, safe treatment, parental education, and prompt escalation when needed. 1. Assessment and early recognition. Nurses play a key role in identifying jaundice early. Observe for signs of jaundice. Inspect skin, eyes, sclera, gums, and blanching of chest or face under good light. Assess the extent of yellow discoloration using cephalocaudal progression from head down. Monitor the baby's alertness, feeding pattern, tone, and cry. Check vital parameters: temperature, respiration, heart rate, and oxygen saturation. Look in TSB based on hospital protocol. Plot results on bilirubin nomograms according to age in hours. Inform the doctor immediately if bilirubin is approaching treatment thresholds. 3. Support effective feeding. Adequate feeding helps reduce bilirubin. Encourage breastfeeding 8 to 12 times per day. Assist with positioning and latching. Monitor urine output, greater than or equal to 6 wet diapers per day by day 4 to 5. Monitor stool frequency. Passing stool helps eliminate bilirubin. Identify poor feeding early and notify the healthcare team. 4. Implementing phototherapy safely. If phototherapy is ordered, nurses must ensure safe and effective treatment. Before phototherapy, explain the procedure to parents. Remove baby's closed diaper. Shield the baby's eyes with appropriate eye pads. During phototherapy, position baby correctly under the light. Ensure the device is functioning properly, right intensity and distance. Turn the baby every 2 to 3 hours for even exposure. Avoid interruptions. Maximize time under the light. Monitor closely temperature, risk of overheating or hypothermia, duration and weight, vital signs, skin integrity for rashes or burns, eye protection position and comfort. After phototherapy, stop therapy only when bilirubin levels are within safe range as ordered. Watch for rebound jaundice, usually assessed 12 to 24 hours later. 5. Maintaining safety and comfort. Prevent hypothermia while undressed for phototherapy. Handle baby gently, especially if at risk for kernicterus. Keep the baby's environment warm and clean. 6. Documentation. Accurate records are essential. Jaundice assessments, bilirubin results and nomogram placement. phototherapy start/stop times, vital signs, feeding pattern, urine and stool output, parent education and concerns. 7. Parent education. Teach parents in simple, reassuring language what jaundice is and why it happens. Importance of frequent breastfeeding. Signs of worsening jaundice. When to return for follow-up. Safety of phototherapy. When to seek urgent help. Excessive sleepiness, poor feeding, high-pitched cry. 8. Prompt escalation. The nurse must notify the doctor immediately if the baby shows rising bilirubin approaching dangerous levels, lethargy or floppy tone, poor feeding or dehydration, high-pitched cry, seizures, suspected acute bilirubin encephalopathy. Early intervention prevents serious complications like kernicterus. Summary: nurses play a central role in preventing complications through early detection, safe treatment, continuous monitoring, parental support, and timely reporting.